So the next one here, we're going to talk about the subacromial bursitis. The subacromial bursitis. So let's see the picture here. In this picture, this is the same joint that we were talking about earlier, which is the shoulder joint right here, this joint here. So in this joint, you can see here the scapula in this area. You can see the humeral bone in this area. You can see here, you can see, I think is this is the clavicle here, and you see here this is the acromion. The acromion is here, and you see, this is a ligament going between this one here. So underneath here you will see, but let me find a better picture that will be giving me all the information about the shoulder joint. So let's see here again. Mm, okay, here. No, here it is. Let's see this one here. If this is going to be a better one or not. Maybe not. This one maybe is better. Yeah. Yes, this is better. Will give us the information that we need. So let's stick this one, bring it there. But we need another one that will give us more of the info. That it doesn't give us anything. This one just give us a little bit of info. Yeah, so it's not bad, that one. And then this one, this is the clavicle. Yes, so this gives us the information of the ligament, and yeah, so I think that is enough there. So these are the information we kind of will need to understand this joint here. So here. So here is the information we need. So let me check this one better. And here, because this look like it has more of the information than the other one, because it has the names of the joints and all the stuff. So let's take a look at this. So here is the acromion. um, uh, Here is the acromion. This is one of the things that we need to know. And here, this is the the coracoacromial ligament, because this is the coracoid. You see, this is the coracoid. And I'm happy now with this picture because it gives me all the info. And this is the subacromial bursa. That is the bursa that we're looking for, the subacromial one. And then this is the coracohumeral ligament. So the coracohumeral ligament, which is not and then this is the greater tubercle of the humerus. That is the transverse humeral ligament. And this is the tendon sheath. And here is the tendon of the long head of the bicep brachii. Okay, this is the long head of the bicep brachii, is going to go underneath the transverse humeral ligament, which we don't need for this one. The articular capsule, which is reinforced by the glenohumeral ligament. So this is the glenohumeral ligament, because the glenoid capsule there. So here, and the subscapular, this is subscapularis bursa. We can just look at it too. And then this is the tendon of the subscapular muscles. And the subscapular, you see where the subscapular muscle is, and that's it. So then let's come and take a look after we remove most of the stuff. So this is the ligament that was said earlier, which is the coracoacromial. So the coracoacromial joint is right here. This one here, the ligament, and this is the acromion. This is the bursa we're talking about, the one that is have the bursitis. And The rotator cuff muscles tendon is right there, because that tendon is the tendon that is supposed to come up, right? So here this is another, here this is the supraspinatus muscles, because the supraspinatus tendon is the one that is going to be injured here. Okay, so now let's go to the real thing. So here it is. As you see, inflamed tendon, you see that tendon, which is the supraspinatus tendon, which is this one here, which is this picture here. So this is the supraspinatus tendon. You see where it is? This is the one that we have here in this picture. So as you can see, this is the supraspinatus. So I will just go and write it there so that we will have it here, right here. So the supraspinatus tendon is going to be the one here, but this is actually the muscles. This is the muscle, this is the muscle, and this is the tendon. Okay, so that is the tendon of the supraspinatus. Okay, so yeah, so here, so then the bursa is filled with fluid, so because of the bursitis, and that's it. So now let's see what is the whole thing about this one. The whole thing is saying the subacromial bursitis, which is inflammation of the subacromial bursa, is often due to the calcific supraspinatus tendinitis. You see the supraspinatus muscles, the tendon of the supraspinatal muscle, it get calcified, and so it lead to the tendinitis. So this is causing a painful arc of the of abduction. With the action of the abduction, there will be pain. Okay, so as you can see, here is the picture, and here is the image that the radiologic image that was taken, and here it is. You can see here how it is, this area. So this is the muscle, and here is the tendon in this area. So, and look, probably I'm not sure if this is the bursa in this area here. Okay, I'm not sure what that is, but that's what they are pointing at, so it's probably the bursa. Now let's see here, what does it say? It say there is a discomfort. I'm reading in this area here, down here. So there is a discomfort. I'm reading in this area. So there is a discomfort with lying on your shoulder, pain on the outside of the top of your shoulder. You see, this is the outside. It's kind of into the outside. If you look at the other, you see the bursa is to the outside, just near the area of the deltoid muscles. As you can see, all of them here, you see the bursa is kind of to the outside. It's right here also. This is, you see, this is the subacromial bursa is also to the outside, and there is another one. So it started up there. That's why in the picture we were seeing something there, and you see this was the tendonitis here. So you will have to the outside of the shoulder, and pain to the outside or the top of the shoulder, pain that gets worse when you lift your arm to the side, and then the pain when pushing or opening a door when trying to uh, circle your arm. Also there is a pain when trying to circle your arm, and also there is a pressure and pain when pushing on the top of your shoulder, if you push on top of your shoulder. So we know now what is the calcific supraspinatus tendinitis will cause the subacromial bursitis, and that will give us pain.